Low-calorie recipes, 15-minute workout. Scroll through any social media and you'll see influencers promoting the healthy lifestyle. Some posts even have millions of likes. But then, why is the world struggling with diabetes? In many countries, diabetes patients are increasing yearly, and the IDF, the International Diabetes Federation, estimates that the number will reach 643 million by 2030. Even in Japan, the birthplace of tofu and washoku, demographic changes and lifestyle changes have affected the population. Currently, about 10 million people have been diagnosed with diabetes in Japan. And according to statistics from 2019, 60% of those patients are over 60 years old. The Tohoku region that I am in has especially been affected by diabetes, with the worst 3 prefectures of diabetes death rates in Japan. The diabetes patients in Tohoku are also older, with 23.2% of the patients being over 70 years old. So, what can we do?
Hello everyone, this is Team Zunda from Tohoku University. Our team is made up of 4 members, all undergraduates of medicine. Hope you enjoy our presentation. First, to find a solution, we need to look into what diabetes is. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. The main 2 types are type 1 diabetes, which is prevalent mostly in younger patients, and type 2 diabetes, which any demographic can develop.
Type 2 diabetes is said to be caused by a number of factors, namely being overweight, not getting enough exercise, and genetics. However, the genetic aspect of diabetes is rarely acknowledged by the general public, and personal lifestyle choices are usually named as reasons for developing type 2 diabetes. We can see that although type 2 diabetes is not widely considered to be a genetic disease compared to type 1 diabetes, patients with a family history of diabetes have a higher chance of developing diabetes without being overweight, making it harder for patients to be aware of their risks. There is also research that family history can also affect the perception of diabetes. While patients with a family history were more likely to consider the genetic component related to the development of type 2 diabetes, patients without family history or without the acknowledgement of family history were more likely to consider environmental factors such as exercise, nutrition, and so on, as a reason for the development of their diabetes. With these results, we can say that without family communication on diabetes, people are likely to solely blame personal lifestyle factors as a reason for the development of the diabetes, which can lead to a negative impact on mental health. Depression, among other mental illnesses, are known to hinder treatment, which makes mental health management crucial.
In Japan, family communication and depression are both big issues. Many families have children living in urban areas while their parents reside in rural areas. For such families, it is difficult for the children to travel back and forth for medical appointments. However, as stated before, it is important for the children to be aware of their parents' health conditions. At the same time, many elderly family members are put into nursing homes where they have very little contact with relatives and friends, which can cause mental health problems. To solve this, we are proposing a system that enables patients, their family, and their healthcare providers to meet online via Zoom. We have named this program DIABLOGUE, hoping to promote dialogue in diabetes treatment. We With this program, patients can make meetings with their healthcare providers where family members can join. Meetings include doctors, nurses, psychologists, and nutritionists, and the patient can inform their family on their current situation and problems with the help of healthcare professionals. The registration system is very simple and only email and Zoom will be used in the program. Also, a PDF, which will be sent before the meeting, will enhance patient and the family's understanding. Using this tool has the following advantages for patients and their families. One is that it allows them to view their current situation objectively. During diabetes treatment, patients may often feel depressed. By being able to objectively see the progress of their treatment, this can provide emotional support for both patients and their families. In addition, medical professionals can understand the patient's lifestyle better and incorporate that into their patient treatment plan. The automatic note-taking tool can also help participants concentrate on the meeting without having to take notes.
However, there are some problems relating to this technology, the main issue being that the elderly have a hard time using online tools. To solve this problem, we have considered the following two methods. The first method is to create a system that is easy to understand. This includes making the text larger and providing a step-by-step manual to make it easier for people to understand. The second method is for the patient to participate in these sessions at the hospital after their routine checkups, while their family members participate online. This allows family members living far away to stay informed about the patient's condition without the hassle of technology for the patient. These meetings can be scheduled at the hospital or at home, and registration will be announced by email to participants with a file that informs the overview of the sessions. Since this is mostly done online, the time frame is much more flexible, and families can join the conversation without waiting time at the hospital, making it easy to implement.
Now, how will we get people to use this app? We will show you a quick timeline. From June 2024 to December 2024, a free app will be provided to gather feedback from patients, families, and healthcare providers through surveys, which will be used to improve the app. From there, starting in April 2025, a subscription model will be introduced where hospitals will cover the costs. After April 2026 onwards, the aim is to expand the system to the entire Tohoku region, starting with affiliated hospitals of Tohoku University Hospital.
What about the budget? We estimate that the overall budget will be $110,000. First, 500 tablets will be lent to households in Miyagi Prefecture, costing $96,000, addressing the 1,071 annual diabetes outpatient cases at Tohoku University Hospital. Additionally, 300 doctors will receive online-related training, 3 hours at $100 per doctor, totaling $30,000, and explanatory pamphlets will be distributed to all diabetes outpatients. Assuming there are 1 million patients in Tohoku region, the cost will be around $10,000.
せーの、ありがとうございました。